my journey with my disease started in the year 2020 during pandemic. At the beginning, it looked like chronic acidity. Then I took antacids, and in spite of taking the antacids, it was not subsiding. What would be the disease type? So since both my parents were cancer patients, the doctors were not at all taking any kind of chance. So they were insisting me to take one more CT guided biopsy from my lower pelvis region. Then when they took the CT guided biopsy from my lower pelvis region, that's when they have concluded that I have follicular lymphoma grade 3B. In 4th and 5th and 6th cycle, post completion of 6 cycles, the disease was remitted. So then post that I have been put on the protocol visits, and then post 3 months again after the 6 cycles of chemotherapy. When they did the PET CT scan, the disease was relapsed. So then post the relapse of the disease, they asked me to undergo further chemo cycles. Then post the further chemotherapy treatment, the disease was not at all remission. It was not all remitted. Then the only option left out was to go with the BMT. One of my close friends took me to one of the family doctor. Then that family doctor, after going through my reports, he suggested me that go to the best in and around Bangalore. So the best doctor he suggested is Dr Sharat Damodar in Narayana Health, Health. So then in the year 2022 August, I walked into NH.
My name is Dr. Sharat Damodar. I am the head of adult hematology and bone marrow transplant at the Mazumdar Shah Medical Center in Narayana Health City in Bangalore, and also the chairman of the oncology services of the Collegium of Narayana Health. Now, when such a disease presents itself, then typically the treatment modalities left are trying to give more high-dose chemotherapy, trying to achieve remission, and then try and take that person for an autologous stem cell transplant. But clearly the outcomes are not very good when you have persistent disease. This is best done when somebody's had a very good response to chemotherapy. So we had this person who had this little dilemma or situation where persistent disease, not too many options, knowing that the outcomes would not be that great. And clearly the emotional and the family background in this setting is clearly very distressing to such a patient. So at this point in time, thankfully, we had a lot of talk about immunotherapy and CAR T-cell therapy happening around the world. And the Indian population and Indian patients and the doctors were all looking forward to this kind of treatment being available in our own country so that we could offer this to our patients. And at this particular time when Mr. P see us, we had this trial being initiated by Immunil, which was the first of the kind industry-sponsored trial in the country. And we were just trying to see whether he would be eligible for this.
Before enrolling for CAR T cells, they have to ascertain some of the results, and for which they took some of my biopsy samples from my neck as well as from my abdomen. And then they have concluded that I will be suitable for the CAR T cells.
So I raised this topic with Mr. And clearly, since this would be the first time this would happen in the country, he obviously wanted to know more about this. And at this point in time, we only had references from out-of-country data. So I advised him that the best thing for him, since he was educated, was to go back and look up and see what this treatment was. And he was very keen and interested in this kind of modality, just like how we were interested to kind of initiate this for our patients. So Mr. P did his homework and got back, and he looked pretty convinced and said he's surely wanting to go ahead with this kind of thing, clearly seeing that the results in the Western world were so much better off compared to just chemotherapy and undergoing autologous stem cell transplant. So with that in mind, we took upon this task of actually enrolling him and taking him into this trial.
and post apheresis process, then my COVID has relapsed, and for the COVID also they gave me proper treatment so that I will be COVID free before getting into this CAR T-cell therapy. 31st October, that's what I can remember the exact date when they admitted me for the CAR T-cell, and in a phased manner they administered the CAR T-cells in 10, 30 and 60%. So in a matter of 2 weeks, I was back to normal.
So Mr. was admitted, went through all his tests, and then the cell collection happened. There was adequate cell dose, and then he was dosed, and he was monitored in the hospital for about a month. Thankfully, the journey was quite smooth. He didn't have too much of trouble, had a little bit of infection which settled down quickly, and then he was all set for the first evaluation, which comes in about a month after the infusion, and that was the PET scan which had to be done. And thankfully, lo and behold, the PET scan was absolutely clean in that first setting. And then post that, he was discharged. He went home very happy to see that result.
So my PET CT scan after the line of treatment CAR T-cell, it has come 100% remission. So that's when I felt that I have achieved a victory over this disease. Of course, the credit I have to give to Mr. Dr. Sharat Damodar and his entire team.
Once he attained or achieved this remission, he also got back to work, because this is somebody who's a productive member of the society. He needs to get back and take care of his family, and there are people who are dependent on him. So it was very crucial for him to get back to his routine life and his work, and he actually managed to do that, and he was back to his routine activities. So this was a great event for us to see him get back to normalcy and his earnings, so that he could continue with his life, continue his follow-up as per our protocol, getting regular tests and follow-ups with us. And gradually over this 3-year time period, he's crossed multiple milestones and now reached the 3-year milestone, and he's doing extremely well.
As far as CAR T-cell is concerned, you can see the results are there. This is post CAR T-cell. I'm completing almost 3 years. And in the span of 3 years, I have seen minimal side effects and coming back to the normal life. And even though it is an out-of-the-box line of a treatment, even though it is a new line of treatment, people might have some kind of apprehension before venturing into it. But I must say, please don't hold back.
This is a big step forward in the treatment of cancerous diseases. We were always dependent on chemotherapy, which is more kind of a carpet bombing kind of treatment. But now if you can re-educate your own cells to kind of go and come back and kill the tumor cells, nothing is better than that, because the side effects are so much lesser and the remission rates are so much longer. So this is what I would like to conclude with, to say that this is truly magic which has happened in this particular patient's journey.
Explore and pursue this line of treatment, and this line of treatment, whenever you pursue with the right spirit and with the true spirit, if you pursue it, the result will always be on the brighter side.